Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. As the nation proffers solutions to the EndSARS unrest, President Muhammadu Buhari meets virtually with former heads of state. Mixed reactions meet announcement of reopening of tertiary institutions in Taraba by the state government. And France puts 46 million people under COVID-19 curfew after a record number of infections in one day. And while the world continues to fight the coronavirus pandemic, wear a mask, protect your loved ones from COVID-19. It's a message from the World Health Organization, who says to break the chains of transmission, we must do it all. The Nigeria Center for Disease Control, NCDC, confirmed 138 new cases of COVID-19 and 2 deaths in the country. The 138 cases were reported from 12 states and the FCT, with Katsina recording the highest, 44, followed by Lagos 35, Kwara 15, Kaduna 13, Plateau 7, Imo State recorded 6 cases, Adamawa 5, Rivers recorded 4, Yobe 3, 2 in Ogun, 2 in Oyo as well, 1 each in Osun and the FCT. Total confirmed cases till date are 61,805. A good number of people have also recovered, and that is put at 56,985. Former heads of state are putting heads together on how to resolve the EndSARS unrest in most states. President Muhammadu Buhari convened a virtual meeting with the leaders and some of his aides, including the Vice President, Professor Yemi Osinbajo. Those participating virtually from their homes include General Yakubu Gowon, Chief Olusegun Obasanjo and Abdulsalami Abubakar, Dr. Goodluck Jonathan, and Chief Ernest Shonekan. While those physically present at the council chambers with the President include the Vice President, Secretary to the Government of the Federation, Chief of Staff to the President, Professor Ibrahim Gambari, as well as the National Security Advisor, Major General Babagana Monguno. Others include the Chief of Defense Staff, General Gabriel Onishaki, Inspector General of Police, Director General, Department of State Services, Yusuf Bichi, and Director General, National Intelligence Agency, Ahmed Rufai. Although the agenda is not known, it may not be unconnected with the recent happenings in the country. Still on the EndSARS protests, governors of the 19 northern states at an emergency meeting in Kaduna have condemned the wanton destruction of lives and property in some parts of the country. During the meeting chaired by the governor of Plateau State, Simon Lalong, the governors expressed concern on why the protests have persisted despite the magnanimity exhibited by the federal and various state governments.
The meeting discussed the various dimensions of EndSARS protests across the country. While appreciating constitutional rights of all citizens to express concern, even by way of protest, it, however, condemned the incessant destruction of lives and properties that ensued in the process. Forum commiserates with those who lost their lives, the wounded, and those whose properties were destroyed. Forum strongly sues for unity and peaceful coexistence of all citizens and groups of people in Nigeria, and urge all Nigerians to see themselves as equal citizens of the country, as the unity of Nigeria cannot be compromised. The Forum regrets the diabolical influences in form of hooliganism, ethno-religious bigots, and even political marauders who are bent on pulling the nation down its knees and pushing for regime change. The Forum call on all Nigerians to resist these enemies of the nation by supporting Mr. President, the federal government, and democracy at large.
On his part, the governor of Zamfara State, Bello Matawali, says he supports the operations of the disbanded SARS. He, however, asked the federal government to deploy the former SARS operatives to his state to assist in the fight against banditry and other forms of criminality.
What we are saying is that, like people that agitating for NSAS, we in Zamfara State, we need all of the SARS in other states to bring back to Zamfara State because we know how they are contributing to end this banditry and the other criminal aspect in the state. So because the SARS are doing a lot in the state, most of them that are, arresting these bandits, going bush day in, day out, are SARS personnel. And since the disbandment of the SARS, we are now having a lot of pocket crises in the State. So we are, in fact, I am to see Mr. President because the security situation in the State as at yesterday is very bad, and we hope government will do something so that to curtail this issue of insecurity in the State.
And after embarking on an extensive tour of Lagos State to ascertain the level of destruction during the Lagos protest, the governor, Babajide Sanwo-Olu, says he is deeply pained by the level of damages to government and private infrastructure. At a briefing at the State House in Marina, the governor says 120 BRT buses and a terminal were among the infrastructure destroyed by hoodlums. He says the Endzones panel of inquiry will begin sitting on Monday and that government is easing the statewide curfew as people are now allowed to go out between 8 a.m. and 6 p.m. He also assures that government will pick up the bill of all wounded protesters and that the cleanup of Lagos will begin tonight.
We've decided that we're going to be easing the curfew from tomorrow morning. And so what that easing means is people will be allowed to go out from 8 a.m. in the morning till 6 p.m. in the evening. For emphasis, from 8 a.m. tomorrow morning, you will be allowed to go out, to go to wherever you wish till 6 p.m. in the evening. We have also commenced the cleanup of the city because the city needs a whole lot of cleanup, a whole lot of roadblocks, tires burned on the road. And so Loma, like you've seen, are out already. And so they'll be working all throughout the night. But in the event that they do not finish, I want to admonish and appeal to motorists and our citizens to be careful on the road. Please, if you do not need to go out, please stay at home. But if you must and you have to go out, please drive with a lot of caution because there's still a lot of barricades, there's still a lot of burnt tires that will have broken bottles and broken things here and there. So please be careful while you're on the road. We will try and clean up the city overnight. They are out already. We've pushed all of the men and women of Loma. They are out already doing the cleaning. But in the event that they do not have the capacity to clean it up fully overnight, I'm just advising all of us to just drive cautiously. We will
The Osun State chapter of the Nigerian Medical Association is applauding the state government for the commitment shown in combating the coronavirus pandemic. The commendation is coming from the chairman of the association, Mr. Abraham Musa, during an event to mark the 2020 Physicians Week in Yola, the state capital.
We realize also that all along our economies have been found foolish penny-wise, spending money in the wrong places, not providing social safety nets for people, and now the disease has wiped away their livelihood and we are spending huge sums of money to give palliatives to people. Wouldn't it have been better to have provided them with livelihoods that were sustainable and not come and spend money on palliatives? Now, there were so many things that were good with COVID-19 that came up. One is that we became more conscious of our neighbors and we gave solidarity. Health workers were brave. In Adamawa State, over 33 health workers were infected and some even lost their lives, but health workers continued to go out to be able to provide care.
The COVID-19 response in Adamawa State has been in two phases: the containment committee and the emergency operations center. Now, the containment committee is a high-level coordination committee that is headed by the secretary to the state government, with the highest medical doctors being represented on the committee and other stakeholders in both religion and civil society.
Now, U.S. regulators have given full approval for the antiviral drug remdesivir to treat COVID-19 patients in hospitals. The U.S. Food and Drug Administration, FDA, said Verclery, the drug's brand name, cut the recovery time on average by 5 days during clinical trials. We have joining us from Abuja studios pharmacist Biola Ajenifuja, clinical pharmacist, Gwarinpa General Hospital, FCTA. She's also the chief pharmacist there. Thank you for joining us on the program.
Thank you for having me once again.
First, what's your take on remdesivir's used to treat the SARS-CoV-2 virus?
Yeah, remdesivir, being an antiviral drug, has been used in various countries for the treatment of COVID-19. But recently it has been approved by the FDA in the United States for treatment because they found out that it reduced the length of stay in the hospital by 1/3. That's reduced it from 15 to 10 days. But as at last, I think 4 days ago, there was a study by WHO, which was backed by WHO. This study was carried out in 30 countries, about 11,000 participants, and over 500 hospitals were involved. And the result, the findings of this clinical studies shows that because 4 drugs were tested actually, remdesivir was one of them. Lopinavir, ritonavir, which is an HIV drug, was tested too, hydroxychloroquine and interferon. And they found out that there was no any significant improvement in patients in which these drugs were used on. So based on that, though these findings has not been peer-reviewed, so when it has been peer-reviewed, they're going to release the findings, but preliminary studies have shown this. So based on that, WHO has not really approved the drug, but the FDA said their own studies prove that it has reduced the length of stay in the hospital for people that use the drug on. So it has been approved there. So I think there are still more studies that need to be done across the world, not just limited to just one country, so that we'll be able to finally have a say on whether this drug actually can be used for the treatment of COVID-19 and for it to gain approval for the treatment.
Indeed, and for something as important as a treatment for a virus that, lots of countries are still recording many cases, even different waves. For example, the FDA says that the drug should be used for use in adults, pediatric patients, 12 years of age and older, and of a certain weight as well, and also treatment of COVID-19 requiring hospitalization. I mean, these are a few sort of factors which are involved for treatment of remdesivir.
Yes, because like the age 12 has to be above 40 kg. So it can be used for any child that is weighing less than 40 kg. So I think there are still some restrictions on those drugs. So further studies need to be done for us to get a final approval on it. And based on their own studies, that's why they've approved it. But other countries, it hasn't been approved yet. So it's only in the United States that it has been approved for the treatment. So I think we still need to work more on other drugs so that we should have a variety of drugs that we can use for it. Like there was a center in Nigeria, for instance, in the FCT, ivermectin, which is an anti-helminthic, was used, and they got a very good result from the use of that ivermectin. So I think we should not limit it to just remdesivir. Let's widen our scope so that we'll have a large alternative to use, because remdesivir is a very expensive drug. Averagely in the United States, for a 5-dose, for a full dose, because it's taken for 5 days, for a full dose, they will need the person will need to spend up to like $3,000. I know that's lots of money. So I think we should not limit our scope just to remdesivir. All other drugs should be tested, and so that we can widen the scope of treatment of the COVID-19.
All right. We'd like to appreciate your time on the program. Biola Ajenifuja, clinical pharmacist, Gwarinpa General Hospital, FCTA. Thank you for joining us on the program.
Thank you for having me. It's a pleasure.
We have more on the COVID-19 updates when we return. Please stay with us. And despite the pronouncements by the Taraba State government for tertiary institutions in the state to resume academic activities in view of the drop in coronavirus cases across the state, ASU and ASUP say they will not heed to such. A visit to some of the institutions indicate that no academic activity is taking place as the institutions look deserted. However, Federal Polytechnic Bali appears set to resume academic activities following directive from the federal government.
His Excellency, the Executive Governor of Taraba State, Architect Darius Ishaku, has approved and directed the Ministry for Tertiary Education to reopen all tertiary institutions under that particular ministry.
It is important to say it clear here that the universities were closed while we were already on this strike. The government shut the universities on occasion of the pandemic. And so the government has already said that the environment is safe. For us, our take is we went on strike. The issues for which we went on strike remain largely unaddressed.
Adequate arrangement has been put in place. The hostels as well as the classes have been fumigated. Actually, the surroundings of the school has been sanitized and they have been fumigated. The students were adequately been informed that they should come with their face mask and the hand sanitizers, and they were encouraged in the washing of hands so that at least they will be prevented from this COVID-19.
Now let's switch to the global scene of COVID-19 cases. Rob Watts is the Deutsche Welle correspondent. He joins us on the second wave of the coronavirus surging through Europe. Hello, Rob. How serious is the situation in Europe right now?
Europe is very much in the grip of a second wave of coronavirus. We've seen the number of daily cases for the entire continent double in the past 10 days. So the continent's seeing around 200,000 cases per day at the moment. And we've seen a couple of countries pass the morbid milestone of having their 1 millionth cases over the past week. That's France and Spain, both of those countries saying that they are struggling to keep control of this virus. Spain saying that it is losing control. France has been posting extremely high daily new case numbers, 40,000 new cases in France yesterday. We're also seeing high numbers of cases in the United Kingdom, for example, the Netherlands, but also smaller countries like Belgium and the Czech Republic are becoming real causes for concern. The Belgian government saying that they're in a very serious situation there. Their testing system is struggling to keep up with the number of people who need testing. And over in the Czech Republic, which has the highest number of daily cases per 100,000, so per the size of the population in Europe, the government there has said that they have really lost control and their hospitals are struggling to cope. The Prime Minister, Andrej Babiš, has apologised for having to reintroduce the strongest measures that they used during the first wave of coronavirus. So Eastern Europe as well as Western Europe, both in a very serious situation with the coronavirus at the moment.
How is Germany coping with its second wave?
Germany posted a record number of daily cases on Thursday, 11,200. And you compare that with the previous record for the country, which was less than 8,000. That's a big jump, and one that has caused a great deal of alarm. The Robert Koch Institute, the health institute here in Germany, has said that the situation at the moment is very serious. However, the numbers that we're seeing in Germany, when you compare them with other countries in Western Europe of a similar size. It's not to the same level of seriousness. There is a feeling that Germany can get on top of this virus and can regain control of it. There are measures that are being introduced to try and stem the spread of it. That depends on the state you're in. So the 16 states here set their own measures. But for example, here in Berlin, there is a curfew, a nighttime curfew between 11 o'clock at night and 6 o'clock in the morning, when the vast majority of businesses are not allowed to be open. Other states have introduced what they're calling accommodation bans, whereby if you come from a coronavirus hotspot in Germany, of which Berlin is one, if you go to one of these states with the accommodation ban, you cannot spend the night unless you can produce a negative test result within 48 hours. So more and more measures being brought in to try and make sure that Germany does not join the ranks of its neighbours who feel they have lost control of the virus.
All right, thanks, Rob Watts, Deutsche Welle correspondent, there with the latest. Well, let's tell you how the World Health Organization is reacting to this. It has reported a new daily rise of 41,104,946 global COVID-19 cases. The organization's dashboard on Thursday showed the cumulative death toll had reached 1.1 million. That's over that number. The previous record daily rise of the cases was 412,889. Here's the global update.
Russia's daily tally of new coronavirus cases hit a record high of 17,340 on Friday, including 5,478 in Moscow, taking the national tally to 1,480,646 since the pandemic began. Authorities say 283 people died in the last 24 hours, bringing the official death toll to 25,525. Russia has started opening temporary clinics and repurposing hospitals in the capital to cope with the rising numbers of coronavirus patients. And in Belgium, one of the European countries worst hit by the new coronavirus, on Friday tightened restrictions on social contacts by banning fans from sports matches, limiting the number of people in cultural spaces and closing theme parks. The restrictions, running until November 9, also include stricter social distancing. They are intended to avoid crowding on public transport and impose a limit of 200 people in theaters, concert halls and cinemas. France's Prime Minister says the country will widen its coronavirus curfew to more than two-thirds of its population, adding a warning that time is running out to slow the spread of infection and avoid even tougher measures. He also says the nightly curfew will be extended from main cities to an additional 38 administrative departments and will now impact a total of 46 million people and include some overseas territories. Meanwhile, the total number of COVID-19 cases in the United States has surpassed 8.4 million, according to the Center for Systems Science and Engineering at Johns Hopkins University. The country's cumulative case count reached 8,404,528, including a death toll of 222,977, with the U.S. outspacing other countries in the number of reported cases as well as the death toll.
Well, although there's evidence that younger people are at low risk to COVID-19, low risk doesn't mean no risk. Continue to take responsibility. Visit our website, channelstv.com. There you get more updates, a better understanding of the pandemic, plus several other stories here in Nigeria and across the world. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.